Welcome back to Psychology Works. I'm Dr. Greenaway, and today we're going to be talking about depression. The blues are fun to play, fun to listen to, but if you're suffering from the blues, you might have depression. Hopefully, it's not clinical depression. So we're going to find out what's the difference between feeling upset, feeling down, and actually experiencing a depressive episode. So what is depression? Let's talk about what we call a major depressive episode in clinical psychology. It comes from this book here. This is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It came out in 2013. Before that was the 4th edition, then the 3rd, and so on. It started in the 1950s as a small pamphlet, and it's grown into this work of art right here. All the diagnoses that are available are in this book in different chapters. So there's a chapter on depression. There are essentially 9 key symptoms of major depressive disorder. What we want to see is at least 5 of these occurring at the same time, and it has to last for at least 2 weeks. If it lasts for a few days, that's not really a depressive episode. You may be feeling depressed, but it technically doesn't meet the criteria for what we call an episode. So the first one, obviously it's going to be a depressed mood. Depressed mood most of the day, nearly every day, and that could be just feeling sad, feeling empty, feeling hopeless, or maybe other people observe it or notice it, that you seem tearful. You know, with kids, it can be a little different. Kids, it could be, and sometimes adults too, more irritable, getting annoyed easily. Just some sort of pessimistic, negative mood that seems to pervade. Then we've got number 2, markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. So if you find that things that used to seem fun aren't that fun anymore, or you're not getting the pleasure, you're not feeling the enjoyment out of things that you think would normally cause some enjoyment or pleasure to occur, then that's a key sign as well. So you have to have either one or both of those. If you don't have either of those, already you don't meet the criteria. Now, adding into that, you have to have some of these other ones. Appetite change. So for some people who are depressed, the appetite seems to diminish. Losing weight, not feeling hungry, ruminating over things so much that you just don't really feel like eating. It could go the other way, emotional eating, gaining weight, eating a lot more than your usual. Now, the 4th one, insomnia or hypersomnia. So we're talking about sleep here. It could go either way again. Either trouble falling asleep, can't fall asleep, or maybe you're waking up in the middle of the night or waking up way too early and you can't get back to sleep. Any of those where you're having trouble getting enough sleep. But like I said, it can go the other way too. If you're sleeping too much, you realize you're sleeping 10, 12 hours a day and you still feel run down and tired, that's a key sign. Then we've got what we call psychomotor agitation or psychomotor retardation. So it can go either way again. Psychomotor agitation would be fidgety, restless, not feeling like sitting still. And it has to be a change from your usual self. Some people are just naturally more fidgety, or maybe they have hyperactivity or some other issue that could cause that as well. And it could go the other way. Usually what we see is the opposite, what we call psychomotor retardation. Lying around, listless, less movement than usual. They actually can assess a person's movement by having them wear a watch movement that measures how much they're moving. And when people are depressed, the studies show you just are less animated. You talk with your arms down at your sides. You sit around more. This malaise is happening. Number 6. Fatigue or loss of energy nearly every day. Number 7, feeling worthless. So this one's more about a subjective view of yourself. And this is really helpful in determining if you're just upset about something or if it really is depression. because if something sad happens, you may feel sad about it, and it may be appropriate, and you might not have depression at all. But if now you start thinking about yourself in this negative way, viewing yourself as worthless, feeling like you're letting everyone down, feeling like you're letting your family down, see, that's a little bit different than just feeling sad about some occurrence that happened or a loss in your life. Number 8, diminished ability to think or concentrate. Now listen to that, diminished ability. So if you already have attention problems, or you maybe even have anxiety that can affect your attention, then you would know that that's really part of more who you are, or that it's caused by the anxiety. But if you notice this increased difficulty concentrating, you're trying to read something, you're trying to watch something, a show or something, and you find that you're having trouble even concentrating on it, that's a key sign that you might be experiencing depression. The last one, number 9. This is the one about suicidality. Recurrent thoughts of death, not just fear of dying, but just the idea about death. What would it be like to die? The idea that I just wish I didn't exist, or I wish I was never born, or something like that. It doesn't always just have to be about committing suicide. You also have to make sure that the depression is not caused by some side effect of some medication that you're taking, or the use of alcohol or some other substance that might be causing depressed mood. You would also have to determine that the depression is not being caused by some other medical condition. There are certain illnesses and diseases that are known to induce depression, and that falls under a slightly different category. It would be depression that's caused by the medical illness. If you find that you are meeting at least 5 of these, and at least one of them has to be those first 2 we talked about, then I urge you to seek out a psychiatrist or a psychologist who could actually do a full assessment, look at the background history, see what's going on, and see if maybe you do have depression. If you do, the next recommendation would be one of 2 things: therapy and or medication. Both of these have been shown to be effective in treating depression. If you are going to seek out therapy, I highly recommend cognitive behavioral therapy. It's a specific style of therapy that has been shown in thousands of studies to be effective. Hopefully this video has been helpful, and if you like the video, please press like. You don't have to smash it or mash it. You can touch it gently. That's fine with me. And if you're interested in hearing more about these psychological topics, please, by all means, subscribe. I'm getting my numbers up. I'm getting the word out there. More and more people are watching and listening, so please be one of them. And until then, I will see you in the next video. Now, I'm supposed to have a pick here. Well, I'm going to be playing without a pick.